I went ahead and started the recording. We'll give people a chance to get in. This has been a very well received webinar. I'm happy to have all the people that have registered for that. I know that this is a difficult time sometimes to get on at, during a work week, during the day, and we're all still coming back from our holidays. So I do appreciate everyone who has registered. And we will be having the recording. I know that in the past that's been, a lot of people watch the recording afterwards so that they can continue on with their day, get ready for the weekend. I said a few more minutes to get people in, and then we'll get started because I like punctuality. I kind of a stickler about things like that. I think time is important. And so I like to respect everyone else's time, but also know that sometimes the technology of jumping in on these things takes a couple minutes getting downloaded. And, you would think that all of us would be absolute professionals at this point with Zoom, but still I get glitched up on it sometimes. So we'll just take it all how it goes. All right. I said I can keep letting people on, but I really want to get started because we have a lot of things to cover. So I'm going to share my screen. So what we're talking about today, obviously, is somebody else coming in. Okay, sorry. All right, so we're talking about this new era in cancer care. It's, the hormone cancer connection is what we are looking at. And unfortunately, cancer is on the rise, and we don't really have enough professionals to help to manage with it. I think that we're grossly understaffed with this, and we've got a lot of work to do for managing cancer and for learning with cancer and such. So, as I said, the new era, and I've got lots coming to you. So, I am Marcia Jones. If you do not know me, I am a nurse practitioner. I have been doing hormone management for over a decade now. I have been a nurse practitioner for a couple of decades, and we won't put out ages there. So, I know a few things. And in my career, I have had many experiences. I started as a nursing assistant, then I was an LPN, RN, nurse practitioner. So, I've kind of done it all. And I've worked in many different areas of healthcare, but my passion and what drives me is two things: hormones and functional medicine. So if you're not familiar with functional medicine, I'll review that a little bit later in our chat here today. But it's kind of what I think of as common sense medicine, healthcare, whatever you want to call that. And I wish that there were more people who practice functional medicine or who are aware of it. So just as much as I'm trying to increase the awareness of how hormones relate to cancer and how you can balance those hormones and a lot of other things in your life to help to manage cancer, whether it's preventive or you're in the early stages or whatever phase it is never too late to start with this hormone-focused cancer care. So I want people to know about functional medicine as well as all of these other things. And we've got such a road ahead of us to get people to understand what we offer and the value of functional medicine and how it's completely different from conventional medicine. I have practiced in conventional medicine for, all of my career actually until, probably about 5 years ago, becoming certified in functional medicine. And now I'm making that transition into functional medicine from conventional care because I just feel like, conventional healthcare unfortunately doesn't give all of our clients what they need. We don't get that time we want to spend with you. The insurance companies have so much to say about it. And quite frankly, I know a lot of you are frustrated. I myself was frustrated when I started down my own hormone journey. And that's how I started into hormones, figured it out for myself, and then I've built upon that over the years. And what I'm seeing is a lot of people now coming into the hormone field of care, but they're taking these little courses that, give them the bare minimum basics, and they're not teaching everything that there is to know. And as we go through a lot of this, you're going to see there's a lot to this. There is a lot to functional medicine and a lot to cancer care, I should say. And not just the functional medicine that we cover that goes so far beyond traditional care. I could talk about that all day long, but I know, like I said, we got other things to get into. So I'm going to try to rein that in. And that's why I have all these slides, is because I would like to, keep myself on track, because I am a talker. And I do get a little bit distracted because of the passion that I have for what I do. So like I said, I'm gonna try to keep that reined in. But this is me, Marcia Jones, nurse practitioner, and I have a hormone-focused functional medicine clinic, marciajonesnp.com. It's that simple. That's where you find all the things about the new era of cancer and the hormone approach to cancer management through functional medicine. And like I said, we are in a new era of cancer care. Before, lung cancer was the number 1 cause of cancer, and now we're going into a whole different field of cancer. And the rates are going so high so fast, and it can be controlled, but there's a lot of work ahead of us. So this is a new frontier, and why I call it the new era in cancer care. So 1 in 3 women are going to develop cancer in their lifetime. And so part of my transition into cancer care is because I have been watching this hormone management, as I'd said, and some of the other providers who aren't quite as well educated on the whole scope of um, doing hormone management, that if you don't control these things in a certain manner, that this is going to be out of control, and too many people are going to suffer that don't need to. And so I've watched this trend of these I'm trying to be really good about this. I've watched the trends. I've watched cancer rates escalate over the years in my practice with hormones. And so as I'm managing hormones with my ladies, I've actually started to do the things and educate them on their decreased risk of cancer with that management. But the thing is, they don't care in that moment, is kind of what I'm getting at. They don't really care at all. They just want to feel better. They're tired, they're grumpy, they're gaining weight, they don't know what's going on, their libido's down. These are all the symptoms that women come to me with. But yet I know if we don't get that stuff under control and manage everything around it, then they're headed towards cancer. And we don't want that. So that's why I do the holistic approach. And this statistic of, 1 in 3 is pretty scary. And that's 1 in 3 people who are alive right now, including our children. Breast cancer is the number 1 cause of cancer right now in women. I mean, it's the number 1 cause of cancer, period. Only 18% of the cancer survivors are going to live 20 years after the treatment. And since the ages of cancer diagnosis is getting younger and younger, that's kind of scary. So if you're diagnosed in your 20s or 30s, only 18% are going to live into their 50s and 60s. 69% will live 5 years. That's an even more sobering statistic when you think about that. Because when ladies are diagnosed with cancer, they're most often in the prime of their life. So to think that it's going to be stripped away, it's very scary. This is even more scary. 90%, or hopeful, 90% of cancers are preventable. Just read that, take that in. 90% of cancers are preventable. So, the thought of cancer, that said, your whole life stops when you start thinking about cancer. Whether you feel a breast lump, or you have a family member diagnosed, or a friend that's diagnosed, or you have a scan that's done and there's something of suspicion, everything in the world stops. You can't think about anything else but that until you get the testing back and you get the diagnosis. And then when you get the diagnosis, it's even worse. It's this roller coaster of emotions. It just Every phase of the journey is an emotional phase, whether it's a good one, whether it's a bad one. Sometimes, though, that emotional journey is harder on you than the actual physical aspect of cancer care. Because let's face it, the mind is a very powerful thing. And when we get inside of our minds, it's difficult, and you start thinking about the worst case scenario instead of thinking about the optimistic pieces of that. And so I kind of want to help to give you hope and give you optimism, whether you are diagnosed with cancer or whether you have not been diagnosed with cancer, whichever one it is, whatever you're facing and whatever phase of this journey is. I think I can give you a little bit of hope in the matter. So during my career, this is how cancer care has came to be. My very first encounter with a patient with cancer, of hormone related cancer, that I can remember that impacted me deeply, was a lady who had been diagnosed with ovarian cancer. She was in her 50s. She had been diagnosed and deceased within 7 days. I was working home health at that time, and I remember, being the one that did the intake, and the devastation of the family. and how rapidly this has all escalated for her. And ever since that time, I have had this extreme fear of cancer, specifically ovarian cancer, because it's not always something that you know is happening. And a lot of times by the time you're diagnosed, it's so far into the stages of it that you have a lot of work to reverse that and to destroy that cancer and to get yourself back on track. So that's where I started with cancer. And I mean, obviously, I've been doing this for many, many years, and I've had many encounters with cancer, but there's always those ones that stick out in your mind. And that woman, I connected with her family on such a level because I live very close to them and I live in a very small community. So, as the home health nurse at that time, many years ago, I was able to do IV morphine for her comfort. So the family would call me during the night, and I would go and I would administer that morphine, and I would, go back home. And so we got to talk and spend a lot of time. And when she was pronounced, I at that time was able to pronounce her. They called me, and so we spent many hours reflecting and talking. And as I had done with the patient during that brief 7 days that she had, but I'm so glad that I got that experience and I got to talk to her and her family and bring a little comfort to them. But it's never left my mind. Never. And like I said, during these years, many years, I know they teach us, in the medical world that we're not supposed to have emotions and we're supposed to be kind of detached and such. But I've cried, I've held hands, I've given hugs. Like, I mean, patients and family. This this is what we do. We're humans. And that's sometimes what you need is just that emotional piece. It isn't just about the statistics and the diagnosis and the treatments. There's more to it than that, and it affects everyone. So like I said, every encounter that I've had has impacted me in some way. And, every experience has led me to what I'm doing right now. And I'm not sure about who else on this call, if you're people of faith, but I am a woman of faith. And I believe that God directs me where I'm supposed to be. And he helps me to help those that need me. This right here was the push to help other people more than you could ever imagine. And forgive me, I get a little emotional over it. This is my husband. Um, we have not been married 2 years yet. And within our first year of marriage, his lab work had come back that there were some abnormalities. Now, I do this for a living, okay? So obviously, I know a lot about cancer care, I know a lot about healthcare and such. So his labs were coming back, and it looked as if he may have multiple myeloma. Not the topic we're talking about today, of course, but that rocks your world. So, but from the other side of the fence, so I've always been the caregiver. I've always been that person who can do what I need to do, and I treat my patients like family. But when this happened, well, they just weren't working fast enough for me. I needed the oncologist, I needed the hematologist, I needed all these people, and I couldn't get an appointment. So it just really it hit hard with me. And like I said, I'm a person that if something impacts me, I'm going to bring it to somebody else. If it hurt me, it's going to be hurting you, and I want to do something to make a difference. I don't think it's fair that people should be facing the potential diagnosis of cancer and not get answers, not have anyone to respond to them. Not, I mean, and not every time can you say, fortunately, my husband, it turned out it was a post-COVID condition. And I've learned a lot and done a lot more research because finding that COVID is literally changing our bone marrow and is increasing our risk of cancers and a lot of other things. And like I said, it wasn't a hormone related cancer, but still in the whole picture, the grand scheme of things, this changes everyone's trajectory of cancer and how we deal with it because we have to look at everything. We can't just look at one piece, our body as a whole. It isn't just a breast cancer, it isn't just a multiple myeloma or just a leukemia. And like I said, so from the other side of the fence, I got to see how people have to deal with this. Now, of course, I did start pulling favors in every way that I could, and I started ordering scans for him and such. And if you pay for that stuff out of pocket, you can get it a whole lot faster than if you go through the insurance. So, like I said, we did fortunately find out that it was, post-COVID and not a malignancy. But it opened my eyes, and I don't want anyone to suffer like that if they don't have to. And the more I know, the worse it was on me, by the way. But we will continue to monitor him. But there's way more to that, more stories. But from that experience, I wanted to share that with you because I want you to know that my intention for you is to replace your fear, uncertainty, that despair, and give you answers and guidance and hope. I mean, because that's all we needed. We just needed answers. I can deal with whatever happens. I can deal with treatment. I can process. I can manage, but I needed an answer. And that's what I hope to do for my patients and for people that I encounter. Give them answers and remember that they're human. So the truth about cancer, let's get into the nitty gritty of it now, all that wishy-washy stuff. So there is no cure for cancer. That is the absolute truth. And cancer doesn't care who you are. It doesn't care how much money you have, how old you are, your plans, what you've got going on. None of that. Cancer will strike when it wants to strike. And it's not an emergency though. So as I said, I panicked with my husband because of the things I was seeing, and everyone does this. All the patients I have encountered in my life that I've assisted with, you panic. And I really try to help you with the panic phase because hormones are where I manage cancer. Hormones are what I know. And we have time. When you first get that diagnosis, no matter what stage it is, you have time to stop, take a breath, look at all of the facts and start to figure things out around you and to start to figure out what's really happening and what you need to do and how you can prepare yourself for whatever treatment options that you may have coming forth because there's multiple options and you need to know those. This is my diagnosis of cancer. Cancer is a lifelong, genetically predisposed metabolic disease of the mitochondria that requires a lot of energy, resulting from an immune system that has been broken by toxic exposures, a lack of nutrition. It is fueled by inflammation, which is rapidly on the rise, and it's targeting estrogen dependent reproductive organs. And the number of cases, and is the number one cause of death right now in the United States. Now that's a lot to take in. And that's not for you all to really have to study and to know and understand, but this is the basis of how I practice. This is the basis of how I manage hormones within my practice, is taking all of these things into consideration and managing all of those from all the angles that they need to be managed. And now listen, we're not going to, we don't know everything about cancer. We're still learning every single day, but there really is a lot that we do know. And the more we do know and the more action that we take, the more that we can do to help. So the hormone focus, where did that come from? Well, because hormone-related cancers are the number one cause of cancer, whether it be ovarian cancer, whether it's breast cancer, endometrial cancer, hormone-related cancers are the number one cause of cancer. And I'm going to help you to understand why. And that is why I'm telling you the top 5 hormones of cancer that we're going to review. And a hormone, in case you don't know, it might sound kind of like, what exactly is a hormone anyway? Well, it's just a messenger. And every hormone in your body is connected. So whether we're dealing with, hormones for your adrenals, whether we're dealing with hormones for cancer, hormones for menopause, hormones are all connected. And we have to, play these and manage them and manipulate them in such a way that they all are in harmony. Now, there's over 45 of those, so sometimes that's a little bit challenging, but it can be done. And now these are the top 5 hormones, and I think you may be surprised. Estrogen, progesterone, testosterone, insulin, and cortisol. The first 3, I'm sure you understand, but those other 2, you might be like, what? Insulin and cortisol, what do they have to do with cancer? Hormone-related cancer specifically. So to keep it simple, very simple with that, the primary female hormones are estrogen, testosterone, and progesterone. Estrogen is naturally produced in your body. We have to have it. We're women. We need estrogen. Men have estrogen as well, but at much lower amounts. Estrogen can cause problems in men, but I manage women. And it's very, very controversial. It's so controversial. But the thing with estrogen is that there's 3 different types of estrogen, and I'm not going to bore you with all of that. And estrogen can be metabolized in certain ways. And if we don't metabolize it correctly, that's when we have a problem. Or and it's all this stuff, like I said, I'm not going to bore you with all of that, but estrogen itself is not a problem. We need estrogen for breast development, for the endometrial lining. That's the lining inside of the uterus for preparing if you're going to have a baby or not. For vaginal tissue, bone strength, our mind. There's a lot of studies that show estrogen receptors in the brain, and if you don't have the right source of estrogen, then you can end up with Alzheimer's. So I'm going to, like I said, I'm going to keep to my topic. But estrogen gone bad is more than just the estrogen. So I don't want you to make estrogen the bad guy. It's too much, the wrong type, or if it's not being processed right, which means not being eliminated right. So estrogen, we get this through a lot of exposures. There's a lot more literature on this now, and a lot it's in the mainstream, and a lot more people are aware of xenoestrogens, and that there can be toxins in our food and our things like pesticides that we use, and that gets into our food, fertilizers, things that are injected into the meat products that we eat if it's not organic, our makeup, skincare, shampoos. There's so many things that have these fake estrogens in them that come into our body in so many different ways. And when that happens, it's estrogen. It's still estrogen, whether it was produced by us or we get it from some other way. But if the estrogen doesn't match our estrogen, it's the wrong type. So there's one of the things that has to do with the estrogen related to cancers, the wrong type of estrogen. And if you can't get rid of that, meaning you can't go to the bathroom or process it in other ways because your metabolism isn't working correctly, then you're increasing your risk for estrogen related conditions. And yes, of course, cancer. So it's that imbalance of estrogen or a dominance that increases your risk of cancer. Things that can increase it, like we just talked about, there's of course your natural hormonal cycles. We've got that. Birth control is got estrogen in it, animal products, fat cells. So adipose tissue is a fat cell. They literally secrete estrogen. So there's another thing that increases estrogen in our body is obesity, and obesity is on the rise, which we'll talk about that too. Alcohol, it goes through the liver. You can't process your estrogens as well if you drink alcohol. And then we talked about the personal care products and such and things that are in our home. Progesterone. So this one is produced by the ovaries. You may not be as familiar with this one, but it's also known as the pregnancy hormone. So progesterone is part of what helps to build up that lining in the uterus and prepare the uterus for fertility, implantation if you get pregnant. But what most people don't know is that estrogen and progesterone have this opposite effect. They have to be in balance. When one is high, the other's low, kind of. And so we want them, well, I should say, when one is high and one is low is when we have problems. They should be in synergy. We synergistically manage those. But there is a direct relationship to estrogen. That's the bottom line of that. And it has a lot of role with menstrual cycles, less role with things like our breast tissue. But if there's a lot of estrogen, breast tissue will grow faster. Progesterone kind of puts a halt to that. So when one says go, the other one says stop. That's the best thing to remember about estrogen and progesterone. So too little combined with too much, breast changes. We just talked about that. Now, testosterone. Ladies, you may not realize that you have testosterone, but you do. It does not have as much of a role in what we're going to talk about today, except for the fact that testosterones can be aromatized into estrogen. And I know that's a big fancy word, but aromatization just means being turned into estrogen. That's all that is. Now, testosterone can also help with breast cancer, and there's some new research on that because testosterone also has a limiting effect on estrogen. So if there's more testosterone than there's estrogen, you can have some benefit, but again, it's got to all be in balance because if it isn't balanced, then you get, deepening of the voice, you get dark hairs on your chin, you get all kinds of other issues. So it's all about balance. Now, insulin, this is the one that I thought was going to surprise some people. It's a growth hormone. So if you have too much insulin, you're going to get larger. And I told you that, adipose cells make estrogen. So if you get that connection, it's a metabolic hormone. That was in our definition of cancer. So a lot of people have insulin resistance or diabetes. So if you have those things, that's going to increase your risk of cancers, believe it or not. Insulin, being a growth hormone, promotes tumor growth. So if you have breast cancer and your insulin levels are elevated, whether it's from obesity or hyperinsulinemia, not being able to manage your diabetes, those kind of things, you are going to have less response to cancer treatments and a higher risk of getting cancer because of that whole cycle and the way that it works. And like I said, those tumors are going to grow faster. And it's very inflammatory. Insulin is pro-inflammatory. Talk about that more too. Cortisol. So this is our stress hormone. It's a metabolic hormone. There's that word again. It's a reproductive hormone. Bet you didn't know that. Has a role in immune system function. And going back to that definition of cancer, we know that there's a broken immune system that allows cancer to take hold and do damage, because our immune system is kind of like our security system, and it cycles around and does its, looking around to see things that aren't supposed to be there. And if it's not supposed to be there, then it gets rid of it, destroys it, gone. Well, if your immune system is broken or overwhelmed with all the toxins and things that you're getting from the environment, it might not get to see that cancer cell, and then that's how it continues to grow and turns into tumors. And cortisol also helps to regulate inflammation. So there's a lot about cortisol. But that's the stress hormone. So when you think about that, how many of you are stressed? So now we're really adding up all of the things that increase the risk of cancer, and we put those hormones together that should have you kind of thinking now, like, oh goodness, I have some of those things. What's happening? Maybe I should get that checked. Yes, I highly recommend that you know what your metabolism is, and you have an insulin level checked, and you know your stress levels and things like that. Um, but the conditions of hormone imbalance, since this is my realm is hormone management. Um, these are imbalances that you may recognize that could put you at a risk because your hormones are off balance. Fibrocystic breasts, obesity, endometriosis, PMS, PCOS, that's polycystic ovarian syndrome, in case you didn't know that, but I think most everybody knows PCOS by now. But this right here, these are the things you need to look at. If you have any of these conditions, you might want to start thinking, oh, what is my risk factor? Maybe I should get checked. Cysts and fibrous tissue, though, are not cancer. I just want to throw that out there, because when we're talking about breast cancer, since it is the #1 cause of cancer in women, I tend to speak more towards that and not as much the other ones. But they don't cause cancer, but it's that sign of imbalance that is the issue. The estrogen and inflammation that we've talked about, that is what's involved in the changes in the breast tissue that causes those cysts in that fibrous tissue. Now, obesity, I want to talk about this one. I'm going to just kind of give you an overview on some of these conditions. But obesity, I put this first because it's an epidemic right now. Like, there's a lot of people who are overweight, and we can manage that by managing your hormones. It's a hormone imbalance. So all of the new things like the shots, the semaglutide, I hate to pull that all out, but it's true, because a lot of people are on it and everybody knows it now. They know that name, those GLP-1s. But it's because they are reducing obesity, which is fantastic, but it's not treating the cause. And if you don't treat the cause, it's going to come right back. I mean, think about all the years of all the fads that have happened and the trends that have came through. I mean, we had phentermine, and well, first it was fen-phen. We found out that one part of the fen-phen was not good for you. And now we have the semaglutide. We had gastric bypass surgeries. These are all extreme measures that don't treat the cause. If you don't treat the cause, it's going to come back and you're setting yourself up for problems later. So balancing your hormones, losing weight that way helps for so many other things, including your hormones as well as cancer prevention. So it also, the other thing that with obesity is if you're overweight because you have that insulin and the inflammation, your response to your chemotherapy treatments is going to be worse. You may have to have more treatments, and sometimes it'll be more difficult all around to treat. So the connection there, that hormone obesity, breast connection, it's inflammatory. It's a metabolic condition associated with poor glucose metabolism and high insulin levels. I know that was a lot of medical terminology, but basically it's saying your blood sugar is too high, your blood sugar is not being managed correctly, you've got too much insulin in your system, and everything's inflamed. And why do we care about inflammation? Well, because that's the fuel on the fire. Everything that I've talked about up to this point, that's telling you what's happening behind the scenes, and this inflammation, fuel on fire. Okay. Just, it's going to cause everything to ramp up and just go out of control. So we want to control inflammation. Hormone, obesity, breast connection, this telling you more, the adipose tissue, it converts into androgens. Again, there's my technical stuff. Let me burn this down for you. That's the fat cells that are inflammatory, that are putting out all that estrogen. That estrogen also is being aromatized, and aromatization is inflammatory. So it's just one big ball of mess of inflammation. And then we've got that estrogen that's stimulating the breast tissue to grow, and you already know what's going to happen there. So PCOS. PCOS is another one of those things that is so common right now. It's the increased insulin, increased androgens, that's the testosterones, obesity, and anovulation, which means no periods. So you've got elevated insulin levels, you've got testosterone, you're overweight, and you're not ovulating, so you can't get pregnant. So these are fertility issues, but these are also signs of imbalance of your hormones that could lead to a risk of cancer. The other symptoms you'll have is irregular periods, ovarian cysts, excessive body hair, you start getting weight around the belly, acne, oily skin, infertility. Those are some PCOS complications and things you might recognize. Then you got endometriosis. So endometriosis is where that lining that's supposed to be inside of your uterus actually starts to grow outside of your uterus. And it can grow on your intestines, inside your belly. It can cause a lot of problems. It can also get on the ovaries. And that when it's a sign of high estrogen levels, it's something that usually you have to have either the symptoms lead up to telling you that you have endometriosis, or you have to do this exploratory type surgery. So we try to be mindful of the symptoms that someone is having that could mean endometriosis, and try to help lower those estrogen levels as fast as we can, because this is a big risk for ovarian cancer. And I told you my history with ovarian cancer and how, that affected me, that it's silent. You don't know until it's well advanced. So I want you to know. I want you to be in the know. So endometriosis, painful periods, painful sex, chronic pelvic pain, and low back pain. These are all signs of endometriosis that could, be diagnosed or undiagnosed, or you could be told there's nothing wrong with you after test after test after test. And it's really that your estrogen is high and your endometrium is growing outside of the uterus. So painful bowel movements is another thing. So if you have any of these symptoms, I highly encourage you to get treatment. Seek out functional medicine. I like to think we're the best, because we're going to look at the big picture to figure out what that is, instead of going, there's nothing wrong with you. I don't, the tests are all perfect. It takes advanced testing of your hormones to know what you're looking at and how to take care of those things. So now just plain old irregular menstrual cycles, that can cause, that's a sign of a hormone imbalance. So the result of that imbalance, these hormones tells you that they're just that usually it's the estrogen is too high and the progesterone is too low, and that you are potentially at risk for a cancer. We all know PMS. PMS is another one. Estrogen's too high, progesterone's too low. So those are other things that we can help to manage. But again, I'm throwing it in here because it is a sign of imbalance. Weight gain, abdominal pain, headaches, swelling and tenderness of the breast, because you know now that estrogen goes to the breast. Nausea, constipation, anxiety, irritability, anger, mood swings, crying. Any of these things sound familiar? These are signs of imbalance, and you should get your imbalance checked. Now, PMDD, or this premenstrual dysphoric disorder, this is a very extreme cause, or extreme type of that PMS, and it usually requires some psychological attention. But it also, that's in standard medicine. But if you have extremes, I'm never going to tell you not to go to a therapist. You're going to need the psychiatric management as well. But also just keep in the back of your mind that if you have extreme swings with your menstrual cycles, that this could be a cause of it. The estrogen helps regulate your serotonin levels. Progesterone calms you down. So if you don't have enough serotonin and you don't have enough calming effect, then this is what's going to happen. And then the testosterone piece, it maintains our brain function. So if these are off balance, and way off balance, then that's how we get into that extreme state of PMS, which is actually called PMDD. All right, key points. I know it was a lot. I try not to overdo it, but I can't help myself. Sometimes the nerd in me comes out. Without addressing the root cause, this is the key point of it all. If you don't get to the root cause of that imbalance, you increase your risk of developing cancer. And no matter what condition you have, you are at an increased risk if you don't balance those hormones, because of the pathways and because of that stuff that I told you in the beginning. So the hormone cancer connection, this is it in a nutshell: hormone imbalance, estrogen metabolism, insulin levels, inflammation. That right there is the connection. So what are we going to do about it? Here's the current cancer care model. And this is what, and I'm not going against the current, I would like to go ahead and say that in the beginning of this, I'm not going against the current cancer care model at all. What I'm telling you is that this is what is happening, and there's a different focus than what you're going to get with functional medicine. I think the two can be used synergistically and should be used synergistically to approach everything from a whole manner. And when we go into what the functional medicine approach is, you're going to understand the missing piece in traditional healthcare is, and what we have to offer on this side. So there's a focus on destruction. You're diagnosed, you get in there, you find out what type it is, and this is where your whirlwind happens, where you start going insane because you're trying to research everything, everything's coming at you all at once. Like, what test do you have to have done? What do the test results show? What type of cancer? Is it genetic? Is it not? Is it, da 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 da. And I say I'm talking faster because that's what your head is doing. And all it is let's go in, let's get rid of it, go. Okay, well, there's more to it than that. But we need to get rid of the tumor, but there's more to it than that. If you prepare your body before you go into your treatment, you're going to receive the treatments better. That's my thing on that part. There's a lack of cause analysis. Well, what even caused this cancer? I just gave you a brief overview, and that's very brief overview of the things that increase your risk for cancer. Unfortunately, in oncology, we don't look at these things. And so if you don't treat the cause, you are likely to get it back, or your cancer is going to come up somewhere else. That's a thing called metastasis, or a recurrence of cancer. So you want to know the cause so that you know what you can do to prevent it from coming back. There's lack of nutritional guidance. I can't tell you how much it just fires me up when I hear someone saying, "Oh, they told me to drink milkshakes and eat ice cream." And I'm like, "Oh, no, there's no nutritional value in that whatsoever. It's only sugar, which is going to feed that cancer cell." And so you need a little bit more help with how to actually starve out that cancer cell and increase the nutrition in your body to fight the cancer. And there's a little bit of a lack of emotional support. And I'm not saying uncaring, but looking at the big picture and all that you're going through with this diagnosis. And then complementary therapies. When's the last time somebody in a conventional thing said to you, maybe you should use an infrared sauna? Sauna is able to help with cancer cells and those types of things. IV vitamin C. There's so many other complementary therapies that are overlooked that have been used for centuries that are still just as good now for boosting the immune system and helping to destroy and detoxify. And then there's poor life after treatment support, as in you do the symbolic ringing of the bell, and that leads to a false sense of cured. And you think, "Oh, I survived, I'm cured." No, no, I'm sorry, you're not. For the rest of your life, you have to be diligent to know whatever caused it to happen the first time isn't going to cause it to come back. And what if one little cancer cell wasn't destroyed? And all those things that I told you about, like that inflammation and stress and things that cause inflammation, are still going on, and your metabolism isn't fixed, and your estrogen levels are high, and your insulin levels are high. That one little cell can turn into another tumor somewhere else, or it can cause it to come back. So that's my take on the current system. There's so much more to cancer care than that, so much more than that chemo radiation. And this is another story I want to tell. I have to share with you, my dear Sandy, that has inspired me and many, many others in the world of cancer treatment. Sandy is actually why I stopped worrying what other people thought about my presentation of functional medicine, because I live in a very small community, and sometimes it's not as received as well. And I mean, not even just in a small community. I've had people make comments on my Facebook like this is witchcraft medicine. It isn't. So my dear Sandy, my friend Sandy, I had an IV clinic that offered IV vitamin C treatments. And that is how I met her. And later on came to find out she lived in the same community as my husband before I met him. But anyway, so Miss Sandy, she was diagnosed with cancer. She went through all the conventional treatments. She did the symbolic ringing of the bell. She was cured. She went on about her life. She went for her once a year follow-ups with her oncologist. And she also, though, kept follow-up with a naturopathic doctor, because she believed and more natural approaches, and she wanted the holistic approach to her health in general. So her naturopath had picked up some stuff on her regular screening labs and said, I think your cancer might be back. I think that you need to have your oncologist order some scans. You maybe do some other labs, but I think something's going on and you need to follow up on this. Sandy did. She went to her oncologist. Her oncologist said, it's not back. You did your treatment, it's not back. Wouldn't order a scan. Well, Sandy did not take no for an answer ever. So she continued, she persisted. She did waited, and the naturopath repeated her stuff and said, "No, Sandy, it's not getting any better. You really need to figure this out. If your oncologist won't order the test, then you're going to have to go somewhere else with somebody who's going to listen to you. Okay. So, but Sandy's had trouble because because the oncologist thought that because the information came from the naturopath, it was invalid and just pretty much made fun of her. So anyway, Sandy, finally they order the test. Her breast cancer has come back and it's metastasized to her liver and it's stage 4. Most people would be devastated, especially when her oncologist said, "I'm really sorry, Sandy, we missed this. You're going to die. Pretty much go home and die. There's no treatment we have for you." Well, Sandy starts doing her research. She actually ended up going to Mexico. She is a woman of lots of faith. And in this time, this is Sandy, stage 4 cancer, metastasized to the liver. She's got to figure out what to do. Her doctor just told her she's going to die. She starts a support group for other women with cancer so that she can help to educate them on natural medicine and other things that you can do for your cancer. Like, that's the kind of woman she was. And she never met a stranger. So we babbled quite a bit during her treatments about all of our health and wellness and traditional medicine and functional medicine and the things we love about what we do and what we believe in. So Sandy ended up, so she said she didn't have the money for going to Mexico, but she, too, a woman of faith, she prayed and she got the money. And so she goes and she started the treatments in Mexico. They gave her a good treatment plan with her nutrition. They did the infrared sauna, the, hyperbaric chambers, those kind of, things. And she lived another 6 years, 6 wonderful years. Not miserable, you would think somebody that had metastasizing cancer to the liver would be frail and sick and have issues. No, not at all. She thrived for 6 more years. And even in the end, when the cancer had returned and there was no more she could do, Sandy had hope and faith and love, and she knew she was going to heaven and she was meant to be here to do what she did for others and to help share the message. And so in her honor, I'm sharing the message. And this is functional medicine approach. So functional medicine, what do? We're not witchcraft, we're not hokey pokey. Functional medicine goes beyond those standard labs and it's biochemistry. It looks at it from a different angle and a different perspective. I wish this is what we were taught in traditional programs for healthcare. It's focuses on, life, what makes you who you are, your exposures, all those things make you tick. It's not protocol medicine. And it addresses the mind, the body, the spirit, because like we've went over, this is an emotional ride. You need more than just the physical. And this is the wheel. This is me in some picture somebody made nice. This is our functional medicine wheel. So this shows you all the things that go into functional medicine. All the things we look at: stress, gut health, emotion, detox, mental, exercise, sleep, relationships, spiritual, supplements, nutrition. All of these things make up functional medicine, but it's not hokey. It's science-based, it's biochemistry, and we go pretty deep into that kind of stuff. So hormone-focused cancer care. This is what I do. I know that this is general, but this is what I do in my system is I identify. We look at genetics, hormones, insulin, inflammation, immune repair, the mitochondria, metabolism, obesity, toxins. And I don't expect you to know all these words and all these things. That's my job. Then we address the situation. We look at the toxic burdens. We look at what the overload has done to the immune system, what's keeping you from recovering, what might put you at risk for things to come back. What are those effects? Because if you have a lot of toxins built up in your body, you're actually going to have more side effects from your chemo and radiation treatments. So you want to make sure that you're looking at everything from every angle so that you can, I don't want to say breeze through it. There's still toxins being put into you. So you're going to have some symptoms and side effects, but this is going to make it better. You want a clean system. And that's why I say when there's time, when you're making your decisions, I strongly encourage you to seek out a functional medicine evaluation and get your system in check while you're making your decisions for what cancer care treatments you want to do. Because we want to clean you out as best that we can, give you that system a reboot before you start into another overload of toxins. I like to fuel the body with nutrition, real nutrition, not just food. We have to do elimination. Remember, getting out that estrogen. You need self-care. This is tough. It's hard on you. And we got to decrease the stress to decrease that inflammation. We have to address the mind and the body and the spirit, because our spirit is our higher power that gets us through all the hard stuff. And without that, Whether whoever your higher power is in your spirit, without that, you're just a shell. And I don't want anyone to be a shell of themselves. We balance hormones and decrease inflammation. That's kind of the bottom line of all that when you put it together. But I do want to tell you something on hormone balancing, and I put this in here because I've mentioned it already. If you're not getting hormone replacement therapy correctly, then you may be at risk. I don't want this information that you're getting today to make you think for 1 minute that you shouldn't get a hormone replacement therapy, because I do that also. I'm not just cancer care, that's my focus, but I still manage hormones and balance women, and I do hormone replacement therapy with bioidenticals. I do it for myself. But you have to do all the rest of it. You have to make sure that you're getting rid of the excess estrogens. You're not getting too much estrogen from too many places. So be careful where you get your supplementation from also. So again, I'm going to say functional medicine all the way because we look at the big picture. And then there's testing. You have to have advanced testing of your hormones. The blood tests that you're getting from, sorry, LabCorp, I love LabCorp, I use them, but the basic stuff you're getting from your primary care and from LabCorp, it's not what you need. There's much more in-depth things that go into it. And without going that in-depth, telling you the way that those hormones are metabolized is very, very important to all those pathways I talked about. So we look at it from that perspective and make sure that you're going down the right pathway and try to realign things to make it all better so that you do have a better response to your treatments. And if you're trying to prevent cancer, if you haven't actually been diagnosed or you're in the early stages of it, this is beyond important. It's also very important after your cancer treatments to make sure that you don't have a recurrence of your cancer. And this is the hormone focused cancer care system. This is my system that I use and follow. Identify the cause of the hormone cancer, protect from the spread of cancer and harsh treatments. Then we repair. So this is where that broken immune system, we get in there and we fix that immune system to help it to be able to identify those cells and keep them from taking over. Rebalancing those hormones related so you feel better, you have more energy, you sleep better, you're even going to lose some weight, just in case you wanted to know that one. It's always a perk, right? And when you learn how to lose the weight, even if it's from this cancer program, you're going to change everything and you're going to keep it off. It's not going to be a fad to you anymore. And they're going to rebuild. We've got to rebuild, protect, recover. You want to thrive beyond your cancer treatments. I mean, you don't want to just survive. You want to live and you want to thrive and you want to have a great life afterwards. That's what this is all about. And now these are some of my service packages. You have to hear what I'm telling you what I do. I do consultations. I do, advanced testing. I include that because that advanced testing, I need that to be done for everyone if I'm going to make the difference that I can make. When we're dealing with cancer, there's no other way around it. But I include it in the price of my packages. And then you're going to have 10 total. You can have 10 visits with me. There's another package that's 4 visits. So some people might be like, okay, Marcia, I want to see you for 6 full months. I want to find out my answers. I want to get my testing, and I want you to help me put everything back together in alignment. And then I give you, discounts on your supplements and labs and stuff. And then I do weekly group calls. So like coaching sessions. So when you're with me, your one-on-one time is with me. Like we're talking about you. We're not just, talking about, well, this is what, we're not reading labels kind of stuff. We will if we need to, if you need help with that. But that's for the group stuff. That's for the bigger sessions where I can go really deep into some of that stuff. But the visits are for you and what's going on in your life and what we need to do for you to get you back together. So I have that complete one. That's a 6-month program. Then I have a 3-month program. It's just that, hormone connect and protect, I call it. So we're going to connect those hormones, connect the dots for you and start to protect you. I'm going to give you the information that you can carry forward. And during that time, you'll be in those same coaching calls that I do once a week. And then I have just the basic cancer connection. If you just want to know what are your hormones, where do you stand, what's a good game plan for you, that's what we do. We have 2 visits. One to get to know you, you order your test, and one to go over all of your tests and give you a good start, a good game plan on how to change things. And then if there's other stuff you want to do with me, great. But if you're not sure, that's okay. It's not a big deal. I want to help whoever I can, however I can. And I do plan to do these webinars at least once a month, so that you can get information that you need, beyond what you're searching in your Google, because that internet search is going to drive you nuts also. And I don't want any of you going through that. I do have a few other resources for you. These are completely, totally free. And just because you signed up to do this today, you can get them. Well, marciajonesmp.com, that's where you find me. But this is a PDF guide that I put together, the 21 ways to boost your immune system to prevent cancer. This is a guide that has, all these things you can do to repair that immune system, just the bare basics of it, of course, but it'll get you started in the right direction. You can get that at marciajonesmp.com/cancer hyphen prevention hyphen God. I know all those little hyphens. Don't forget the hyphens or you won't find it. I can also drop it into the follow-up email for you. Well, actually, after you watch this webinar, if you want a copy of that and you can't access it this way, just shoot me a message back, email me, and I'll get it right to you. And then there's another guide that I've put together. It's the sign of imbalance for women. It's another free guide. It's marciajonesmp.com/signs hyphen of, imbalance of guide for women. Put those hyphens in there. And that'll bring that up for you. So you can kind of look at it and you'll start to go, oh my Lord, this is why I'm not sleeping. Oh my gosh, I didn't realize this was a hormone imbalance. But that's where you start in your cancer prevention journey, and even your cancer care journey. So I want you to know there's hope. I hope that I've given you hope in this little chat session we had today, so that what can be done and what can't be done. And if you are interested in doing a free discovery call with me, by all means, marciajonesmp.com. There's a little, it says discover hormone related cancer or something like that. You just click that button, it'll take you right to a scheduling and you can request an appointment with me, totally free. And it's where, and I don't give out medical advice on that appointment, but we just kind of talk over your, do you think you might need some of these services? Do you have questions about the services and how they all work? That's where, you get to know me a little bit more if you want to. That's how all that works. So if you would like to do that, this is how you do that. So I really want to thank you. I'm going to stop sharing my screen right now. I want to thank you so much for joining me in this. And I told you these technology things, I'm trying to stop sharing my screen. And with all of the technology in the world and all the things that are happening, it's hard for you to be able to identify all of that information all at once. So I encourage you to, book that discovery call. If there's something else you want to know from me, please, by all means, I'm happy to help with you. And you guys take care. And I hope to talk to you soon. Book that discovery call, like I said, 15 minutes with me, and you can get to learn a little bit more about things and what your risk may be, and if this might be a good fit for you. So you guys take care, and I will hopefully talk to you soon.